It's a very common problem. We see the patients in general surgery. Hernia is basically a defect, abnormal defect in the abdominal wall, which is made up of the abdominal wall muscles. And through this defect, abdominal contents, mainly intestine, momentum, comes out of this defect of the abdominal wall. Recently, we had one young patient, IT worker, who had a large hernia, maybe from his childhood, because pain was not there, so he
So
was
he
not
kept on pushing
consulted.
it.
But he was very worried about the surgery. He had
Mhm.
a lot of fear about the surgeries. I was so happy after surgery. Next day, same day, he started walking around, because once mesh gets infected,
Hmm.
it's very difficult to treat that
Okay.
infections.
With over 21 years of experience, he is a name which is well known in the world of laser and laparoscopic surgery. Dr. Phulchand Pujari. Imagine undergoing a surgery with smaller incision, lesser pain, and a recovery time so quick that you are back to your routine even before you know it. Yes, that's the story of countless patients who have trusted Dr. Pujari for performing various surgeries, from complex hernia and gallstone surgeries to advanced laser treatments for piles, fissure, fistulas. He is the name that is known to everyone. His expertise extends far beyond what we see in the operating rooms. He is a healer, a problem solver, and a leader in the fields of general surgery. Stay tuned with us as we dive deep into conversation with one and only Dr. Phulchand Pujari. Hello and welcome to Sahyadri Health Talks. I'm Dr. Tushita, and today we have with us Dr. Phulchand Pujari, a name well known in the Department of Surgery. Sir, welcome to today's podcast.
Thank you.
How are you, sir?
I'm doing well.
How are you
Very nice.
feeling coming to
Very
this
nice to be
podcast?
here, and going to enjoy this podcast.
Thank you, sir. Thank you so much. So, we will be talking about hernias today.
Yes, ma'am.
Maybe a very small section out of
Yeah.
the many
Big,
surgeries
big.
that you do.
Yeah, yeah.
But we felt
But
that hernia is something that should be
it's a very
discussed.
common problem. People regularly face this problem, and I think we'll share good information to the people to know about the common symptoms and treatments what are required for the treatment of hernia surgery.
Sure,
That's
sir. Diving straight into the topic,
Yes, ma'am.
hernia क्या होता है, sir?
It's a very common problem. We see the patients in general surgery. Hernia is basically a defect, abnormal defect in the abdominal wall, which is made up of the abdominal wall muscles. And through this defect, abdominal contents, mainly intestine, momentum, comes out of this defect of the abdominal wall and protrudes through the abdominal skin, which is presented as a bulge in the abdominal wall.
Mm-hmm.
Usually, initially, it reduces down. When patient lies down, it reduces down. And so
Acha.
patient doesn't used to have symptoms. Pain, there used to be no pain, but
Acha.
patient just feels the bulge when patient strains, like coughing while straining for the motion, and a patient starts feeling some discomfort.
क्यों होता है, sir? Why does it happen
The
typically?
reason most commonly for this hernias to develop is the increase the intra-abdominal pressure, which commonly happens due to the straining, specifically in patients who smokes, who have a chronic cough, like
Hmm.
COPD patients.
Mm-hmm.
Because of this coughing and strain, abdominal pressure gets increased, and
Mm-hmm.
this increased abdominal pressure tries to get out through the weak points of the abdominal wall.
Acha.
The common weak points are the mostly congenital, we call it as a congenital weak point, like inguinal region, groin
Hmm.
region, from where the testicles comes out through the abdominal wall. Then umbilical region is
Acha.
another common weak point, because it closes at the last,
Hmm.
at the time of birth.
Mm-hmm.
Through these weak points, because of increased abdominal pressures,
Mm-hmm.
this hernia gets developed.
Acha.
Another common hernias we see is the ventral hernia or incisional hernias.
Mm-hmm.
When the patient undergoes through the any previous surgeries, like in females, cesarean sections,
Acha.
appendectomy
Acha.
surgeries, or laparotomies, when we suture the abdominal wall, that
Hmm.
is usually a weak point in the abdominal wall. And
Mm-hmm.
when patient develop consistent increased abdominal pressure,
Mm-hmm.
these weak points get developed into the hernia,
Mm-hmm.
which we call as a incisional hernia.
अच्छा.
So
So
the
ये जो hernias होते हैं, sir, are they painful, always painful, or someone can have a hernia and not know about it?
No, it is not always pain.
Acha.
Specifically when it is in early stage, it doesn't patient doesn't feel any pain. That's
Okay.
why
So he might not
huh,
not even know.
even patient doesn't know about there is a hernia.
Acha.
Sometimes patient present for the other complaints of abdominal pain, and on examination we get to know that the patient is having the hernia.
Okay.
Or sometimes patient gets evaluated for other abdominal problem, gets UAG done, and that time patient get to know that there is a hernia.
So it's more kind of an accidental
Accidental
diagnosis.
diagnosis in early stages.
Acha.
But if it increases over the period of time, the patient starts getting pain or discomfort when it becomes a large hernia. And more risk in this hernia is that sometimes due to sudden increase in the abdominal pressure, these hernias get obstructed, or these contents of the abdominal wall, abdominal intestine, or momentum gets stuck into the hernia defect, and
Acha.
then it becomes a critical, because
Acha.
the blood supply of this abdominal contents like bowel get compromised, and it starts getting necrose. Then it becomes a emergency situation. In that case, then we have to operate the patient in emergency situation. Surgery we have to done.
It
To
typically comes to the
emergency department, and we have to operate the patient to save the abdominal contents. Sometimes if it is necrose, we have to cut the intestine, and we have to anastomosis the intestine.
So you're basically saying ki the more it gets ignored and delayed,
Yeah,
the more complicated
complications
it
can
gets.
happen. So
Okay.
it is always better to show to the doctor if you are feeling that there is some bulge in the abdominal wall, some swelling is there in the abdomen. It's better to show the surgeon or general practitioner, whichever you are consulting regularly, and get evaluated for that. Usually hernia gets detected on physical examination only. It doesn't require very advanced investigations and all. On general physical examination, we can able to know there is a bulge in the abdominal wall, commonly in the inguinal region or umbilical region. And on evaluation, on staining, we can see there is an increase in the size of these hernias, and when lying down it gets reduced down. If it doesn't get reduced down on lying down or on its own, then it is called as irreducible hernia. Irreducible hernia. Or sometimes if it gets blood supply also starts getting obstructed, then it becomes a strangulated hernia.
Okay.
So in that cases, patient starts getting pain, severe pain, and vomiting, fever. So that hernias needs to be treated urgently on emergency basis. The rest of the hernias also, we suggest treatment for hernia is a surgery only.
So there is no or minimal medical management for it.
For hernia, as it is a physical defect, or
So it has to be treated
it has to be
physically.
treated with surgery. We have to close the defect, and we usually put a mesh over the defect so that the recurrence should not happen. There is no medical treatment for hernia. That is the main
So we can
difference
say
between
at
any
least
other disease.
99% of cases of hernia, they require surgery.
Most of the hernia, as you said, 99% of the hernia requires the treatment as a surgery. And 1%, like in congenital hernias, like in babies, newborn babies and all, they also used to have a hernia, small umbilical hernias or congenital inguinal hernias. Usually in such patients, we wait for a few months and early years. So most of the newborn babies, they get resolved on its own. If it doesn't get
that
resolved,
is the
1%
of
patients.
hernia. Sir, as and when we are discussing about hernia, so who are there any particular section of people who are at more risk of developing hernia?
Yes, that's a good question. Actually, there are people who always train while doing physical activity, like doing their laborers who have to lift heavy objects. Patients who have a habit of smoking, who gets chronic cough, or some patients who have bronchial asthma or COPD patient, they also used to have chronic cough. So in that patients, due to continuous increased abdominal pressure, they are prone for the hernias. Another patients who have chronic constipations. in that patients also there is a patient has to strain for passing stool,
Hmm.
and that patients are also at a risk of hernias. Another section of patients like older patients who used to have prostatomegaly. In these
Acha.
patients, patient has to strain for passing urine. These
Mm-hmm.
patients are also at a risk of
Developing hernia.
hernia. So such for such patients, they have to take a treatment for their medical problems
Hmm.
so that they should not develop the hernia. And
Mm-hmm.
if you have already hernia, they should get treated for this hernia. But before treating such patients hernia, we have to treat their medical problems.
Acha. So basically, you treat the
Yeah,
cause
cause of the hernia,
hernia
because if we
first.
didn't treat the cause of hernia and if we just go ahead with the surgery, chances of recurrence are very high in such
Recurrence.
patients.
Correct. Because you have not
You
treated
are
the
not
root
treated the
cause.
cause of hernia, because
Correct.
even after surgery these people keep on straining for their medical problem, like
Mm-hmm.
for constipation, for
Mm-hmm.
urination, and they whatever treated hernia defects are there, they get strained out and they get weak, and patients get recurrence after surgery. So that is sometimes in few patients like prostatomegaly patients, we treat these problems along with hernia also.
Acha.
We treat for the prostate and
Hmm.
hernia together also, so that patient
Acha.
should not get the recurrence after surgery.
Okay.
So
Okay.
these are,
So, sir, as we are talking about, surgeries of hernia,
yes ma'am.
right? So we have already spoken that 99% of cases of hernia needs
Need
surgery, and
surgery,
one
that
percent is that
very
pediatric
very
or
few
infants,
newborn
the
babies and
newborn
all.
babies. So how do you decide whether the surgery is an urgent one or not?
Okay. Usually depends, as we talk about the usually patients who have symptoms, severe pain and vomiting, fever. These patients are used to be obstructed hernia or
Mm-hmm.
strangulated hernia, or
Mm-hmm.
something we call it as an incarcerated hernia. In
Mm-hmm.
such patients we need to do a urgent surgery, because they used to be have abdominal contents get stuck into the hernia sac, and
Mm-hmm.
which doesn't reduce on manual reduction also. And most of the times in such patients their blood supplies get obstructed, and they
Hmm.
starts developing necrosis of that abdominal content, mostly bowels, if it
Acha.
get stuck there.
Acha.
So that becomes a critical situation. In that
Mm-hmm.
patients we have to do a surgery. That surgery used to be a major surgery. We have to open the abdomen, reduce the bowel, and we have to see that bowel whether it is a viable bowel. If it is unviable, means it is a necrotic bowel, then we have to cut the bowel, anastomosis. But in such patients we cannot put a mesh.
Okay.
That is one thing. That's why we always suggest the patient to get the hernia treated before it gets get
Earlier.
complicated,
Okay.
because
Okay.
once there is a infection is there,
Hmm.
because we open the bowel and
Hmm. Hmm.
we join the bowel, so
Hmm.
chances of infection is very high in such patients. So
Acha.
if we put mesh in such patient, the mesh gets infected, so we
Acha.
avoid putting mesh. We just close the defect or close the abdominal wall.
Mm-hmm.
But later on such patients may develop hernia again, and we have to do the definite surgery for hernia by putting mesh afterwards in such patients.
Okay.
So
So, sir, as you spoke, right, that patients who, come as a urgent requirement of
yeah,
hernia
yes,
surgery, one of the complication is that, you cannot put a mesh,
mesh, yes,
and
yes,
then later on you have
we
to
have
do
to
it
do a
again.
definite surgery for
So,
such patients.
like such complications, what are the other complications that you see when patient, keeps on delaying it and lands up in ER
Yeah,
for a, last minute surgery? So what are the complication that happens? Because बहुत लोगों को ना समझ में नहीं आता होगा.
yes,
So they are like, हाँ डॉक्टर ने बोला है थोड़ा टाइम और ले लेते
that
हैं.
is what
But what
happens.
is that time जो और आप ले रहे हो?
Mm.
What is it coming at the cost of? So what are
That's
the
what,
other complications which we see in
yeah,
cases
that's
of
what
emergency
emergency.
hernia?
And the main complications what we talk in hernia is the hernia gets obstructed, then it becomes a complicated hernia. We have to treat it on emergency basis.
Hmm.
In such patients usually used to be have if, another comorbidities like diabetes, heart disease, and all that things, which again cause the patient that post-op recovery becomes difficult in such patients. We have to keep the patients in ICU. We have to give higher antibiotics for such patients. If
Hmm.
these patients goes into the sepsis, then the recovery time gets delayed, and chances of morbidity, mortality increases in
Also,
such patients.
what I feel is कि if there are patients who are on blood thinners,
Yeah, yeah.
the surgery gets even more
Yeah, yeah,
complicated,
that
isn't
becomes
it?
complicated, because In planned surgery, when we do elective surgery, we prepare the patient for surgery.
So you control all the
We usually
parameters.
control, if patient have a diabetes, we control his sugar. We, patient is having hypertension, we can check that the patient's blood pressure should remain normal with medication. If patient is cardiac problem, we check that the patient's cardiac condition is stable, and if he is already on blood thinners, we
Hmm.
by consulting the cardiologist, we check that we can, whether we can stop
Stop
the
the
blood
blood thinner
thinners.
for.
In some patients, if recently any cardiac elements are happen, then we have to shift the patient on the another like Clexane, and then we stop that injections 1 day before surgery. But if such patient comes into the emergency condition, then it
Hmm.
is difficult to
Because
manage
ये
such
सब तो
patient. Yeah,
complications
and
हो
we have to
जाती
operate.
है.
We cannot wait for the blood thinners to stop
Yes.
for 5 days. So chances of bleeding also increases in such
So
patients,
it's a
and
cost of a
yeah,
lot of other
yeah,
things
big
if
risk
you.
is involved in such patients. So that's what we always prefer to operate such patients before getting operated, and
So
we
do not delay
do
it.
not delay it. The people doesn't understand these things, that because patient doesn't used to have pain, so
हाँ.
patient keeps on delaying the treatment for
So दर्द
surgery.
नहीं हो रहा है तो थोड़े दिन और पीछे पीछे
Yeah,
कर
yeah, yeah,
लेते
yeah.
हैं.
They are avoiding the rest of, when patient have pain, patient go for the treatment. But in hernia, that is the problem. In early stages, they don't used to be have a pain, so
Correct.
they delay the treatment for that.
Correct. So, sir, as we are talking about the surgeries, right?
Yes,
So earlier it was an open surgery. Now
yes.
it has come with the laparoscopic
Laparoscopic
surgery.
surgery.
So though the the word itself, terminologies are quite
Yeah, yeah,
self-explanatory,
yeah.
but help us understand the differences a little
Now,
more.
the treatment, as we are talk, treatment for the hernia is a surgery.
Correct.
Previously, commonly we used to do, and that is one of the major component of the treatment of hernia surgery is
Hmm.
the open surgery.
Hmm.
In open surgery, we cut the take the cut on the abdomen over the hernia. We
अच्छा.
open the hernia
अच्छा.
defects, hernia contents we reduce down, then the defect we close the suture, and we put the mesh over it.
अच्छा.
But in such surgeries, there is to be pain more because
Hmm.
of the big cut. Recovery times is delayed. Patient has to stay more time in the hospital. Even patient has to delay his
Returning back to the
returning
regular.
back to his normal activities and office work. But in laparoscopic surgery, which is also called as a minimal invasive surgery, is a recent trends in hernia surgery. Along with that, nowadays robotic surgery is also available for the
अच्छा.
treatment of hernia surgery. In these surgeries, we do the surgery through small holes,
अच्छा.
3 or 4 small holes, and we put the camera and the instrument through these holes, and we reduce down the contents of the hernia. We close
अच्छा.
the defect from inside, and we put the mesh from inside.
अच्छा.
Okay,
Okay.
so there won't be a major cut over the
So it's
hernia.
basically three kind of
3 small
dots.
holes, and
Small
just
holes.
hardly 1 stitch is required for the closure of such defects. And after surgery, patient recovers very fast.
अच्छा.
Especially this minimal invasive surgery. And next day only we ask the patient to walk around. He can his slowly starts his regular
कितने दिन की
activity.
हॉस्पिटलाइजेशन होती है सर?
Hardly 1 or 2 days patients required
And the
after
patient can
surgery. In
hospital.
2 days, most of the times we discharge the patients, and
Mm-hmm.
patient starts his regular activities in 1 or 2 weeks only after
Okay.
minimal invasive surgery.
Okay.
And usually in 4 to 5 weeks, patient starts doing his or regular exercises also
अच्छा.
after minimal
Actually,
invasive
that was
surgery.
my next question. Actually, I
Minimal
wanted to
invasive
ask
surgery, that
you.
is the major advantage, because nowadays people are very health conscious, and they
Yes.
before surgery only they ask about these things when can they start their regular exercises and all that.
Mm-hmm.
So the major benefit of this laparoscopic surgery is the patient can start his regular work very early, and start his regular physical activities, physical exercise in very early weeks.
Okay. So, sir, if you have to give a few tips to your patients post surgery for an uneventful healing,
Yes.
so what would those be?
Mainly, we give advice regarding lifestyle modifications and diet modifications,
अच्छा.
because hernia, as we have talked, happens because of increased abdominal pressure, intra-abdominal pressure.
Mm-hmm.
So after surgery also patient has to take care that the abdominal pressure should not increase much.
Mm-hmm.
So patient has to avoid straining, so patient has to avoid the coughing.
Mm-hmm.
If there is a cough, patient has to take treatment immediately.
Mm-hmm.
Patient has to avoid straining while the passing stool. So constipation has to be avoided.
Mm-hmm.
Usually patient has to take a diet, high fiber diet, and water intake should be more, so that stool should be soft. Or if even after doing this food changes, if patient gets constipation, patient we prescribe the laxatives for the patients.
Okay.
And in other patients, lifting heavy weights and has to be avoided for a few more weeks after surgery. So
Okay.
this precaution patient has to take after surgery. But still, as we are talking, after minimally invasive surgery, these precautions also have become a less time period required to recover from these activities.
Okay. So, sir, are there any exercises that patient should must follow
Okay.
post surgery?
Yeah. Uh, Basic exercises like walking and regular activities patient can do
Hmm.
immediately after surgery. But
Hmm.
post training exercises has to be avoided after surgery for at
Okay.
least 4 to 5 weeks. We suggest that
Okay.
that should not put pressure over the
So after 4 to 5 weeks, you come back to your doctor,
yeah,
get
yeah,
yourself checked
just check
once,
upon.
and
And
then
if
if the
everything
doctor
is okay,
says, then you can
they
go
can
back to
start their
your.
regular lightweight exercises patients can do after 4 to 5 weeks.
Okay. So sir, ये जो mesh होता है ना,
Yes, ma'am. That
इसके
is in.
around there are lot of fear in
Yes.
people. So what are these fears that you common hear about
And there is a
the
very
mesh?
good question actually. Most of the patient used to have a lot of doubts about this
Is
mesh,
it? Yeah.
because this is the one thing from external thing we put into the patient body.
Yes,
So,
yes.
and that is used to be going in the patient's body for long
So
durations.
my question here was कि एक तो mesh से related बहुत
Yeah.
सारे fear है और दूसरा mesh के बिना hernia surgery क्यों possible नहीं होती है
नहीं,
usually.
देखिए, hernia surgery is basically abdominal wall muscle weakness is the main
Okay.
reason for hernia.
अच्छा.
So in doing the treatment for hernia or doing surgery for hernia, we have to strengthen the abdominal wall muscles, and that's why we need the mesh to reinforce the abdominal wall muscles.
Okay.
Yeah, if we don't put a mesh, the just suturing or closing the defect is not going to help the patient for long durations, because of this increase. Whatever work we do, there is to be some intra-abdominal pressure increase at the time of doing our regular activities. That keeps on doing increase the weakness at the this closure of the defects, and patient can redevelop the hernia. So to avoid that recurrence, that's why nowadays recurrence rates are very less, because
अच्छा.
we are regularly nowadays put mesh. Hardly 0.5 to 1% patient gets recurrences. That is very less number of recurrence rate in the era of mesh surgeries. So mesh is basically polypropylene material, which we is like a जाली जैसे हम लोग
तो वही
देखते हैं.
mesh
हाँ,
जाली.
that जाली जैसा
Correct.
रहता है. And then that we put into the abdominal wall, and body tissues grows inside that mesh network,
अच्छा.
and that
Okay.
strengthen on the abdominal wall. The
Okay.
fibrous tissue and collagen tissues get
Which grows
regrowth
on.
in that mesh network, and that
अच्छा.
forms a cement like structure in the abdominal wall,
अच्छा.
and which increase the strength of the abdominal wall, which avoids
Okay.
the chances of recurrence in the hernia. So
Okay.
that's why mesh is very much required for the nowadays. Very good quality meshes are available,
अच्छा.
and only thing is that when we put a mesh, we have to take care that there should not be any infection in the mesh. So we usually
अच्छा.
take a lot of precautions while doing these surgeries, while putting
Placement of the
mesh.
mesh.
We take care that there should be everything should be sterilized well, and even after surgery, we ask the patients to take precautions. There should not be much straining over the abdominal wall, because once mesh gets infected, it's very difficult to treat that
Okay.
infections.
Okay.
Usually we have to remove that mesh.
So that's when the repeated surgery
Surgeries,
after
yeah,
hernia
yeah, yeah,
happens,
yeah.
when there is a typical
No,
infection in the mesh.
whatever you do, if mesh gets infected, it
You
won't
have to
heal. We
reoperate
have to
again.
remove that mesh, then only that infection gets settled down. It's
Okay.
very rarely happens, but if
But
it,
what are the typical causes of this infection? Why it happens?
so that's what we are, as we discussed, if there is a any infected source nearby the hernia,
Mm-hmm.
uh, the chances of mesh gets infected is very high.
It's
So we
higher.
avoid in surgery of hernia with any other surgery which is infected.
Acha.
And in case yes, hernia is itself contained is infected, we avoid
Mm-hmm.
putting mesh, so that
Mm-hmm.
mesh should not get infected. We wait
Okay.
for a few weeks, the infection should settle down, and if patient redevelops hernia, then we put the mesh and
Okay.
repeat the surgery for
Okay.
that.
So, so post surgery, what would be a few warning signs, or typically we call it as red
Red
flags
flags
that patients should look
should
out
look out
for
for
and understand that this needs,
to be
to be
to be
addressed.
addressed.
So, what would be those red flags or warning signs
Usually
post surgery?
post surgery, usually there are 3 4 things patient has to be worried
Look out
or
for.
look out for post surgery, and should consult the doctor immediately. One thing is this: if patient gets fever,
Okay.
patient gets an vomiting, or starts getting pain at the operated side, if there
Hmm.
is any redness over the operated region, the chances of having infection, or sometimes patients get um, swelling again at the side of the hernia operation. Patient has to consult the
So, sir,
doctor.
जब
So
आप बोल रहे हो
these,
कि fever, तो
hmm,
what kind of temperature are we talking here?
it is to be around 100 among the
Above
patients.
100.
Yeah, patient has
Okay.
to. These things, what are the concerns we are having about a patient gets such symptoms? The chances of infection we have to look off. Sometimes patients get bleeding, or sometimes patients get seroma formation after
Hmm.
surgery, because
Mm-hmm.
hernia is basically a bulge in the abdominal wall.
Hmm.
In surgery, we reduce that bulge, we reduce the content, and we put the mesh over that, but that cavity remains there, specifically after laparoscopic surgery.
Hmm.
So in that cavity, the body fluids get collected, so
Mm-hmm.
patients sometimes feel even after surgery there is a bulge, but
Hmm.
we have to address the patient's concern that that seroma gets settled down on its own, we don't have to worry. But if there is any infection in that, then we have to be worried about, then we have to treat the source of infection, and we have to keep watch on that.
Okay, sir. So that's about
Yes.
hernia.
Yeah.
Now moving on to the next section, which is
Yes.
Mythbusters.
Mythbuster.
So I'll
There is a
quickly
lot
read
of
out a few
myths.
myths,
Yes,
and you
ma'am.
have to tell if it is a myth or a fact. Okay. So the
Yes.
first one is hernias only happen to older people.
No, it's not correct. Hernias, even as we talk, there are congenital hernias in newborn babies. Also, we see the hernias, which is called as congenital hernia. In adults, also the people who do regular, very heavy weightlifting jobs or exercises, in such patients also hernia gets developed. And old age is the very common group who gets the
Who
hernia.
gets hernia? Hernias will heal on their own over the time.
No, it's not correct. That's basically a big misconception in the common people. Hernia doesn't get healed on its own, or it cannot be treated with the medicine. It needs a surgery.
Surgery. You can only get a hernia from heavy lifting.
No, that is also not correct. That
Okay.
is one of the cause of getting the hernia, but hernia can happen because of other reasons also, like we have talked about straining at the time of motion, passing stool, hard stools, and at the time of urination, if you, a patient strains, that also causes, even chronic coughing can cause the hernia. These are the other reasons
Other
which can
reasons.
develop the hernia.
Surgery for a hernia is always very risky and very complicated.
No, that is also not correct. Surgery for hernia is a very safe surgery. We regularly do this surgery, and only thing is that in hernia, in old people used to have other comorbidities. In such patients, the anesthesia risks are very high. So such patients, we take care that patients should be prepared well, and if there are very high risk factors are there, then we have to choose the hernia surgery accordingly.
Accordingly. Okay. You should be on complete bed rest if you have a hernia surgery.
No, that is also not correct. Nowadays, specifically when we are doing minimally invasive surgery, next day we ask the patient to walk around, and within few days, patient starts doing their regular activities.
Hernias are always painful.
No, that is also not correct. Specifically, after minimally invasive surgery, pain is very less, and recovery time is also very less.
Hernias always requires an open surgery.
That is also not correct. Specifically nowadays, more minimally invasive surgeries are done. Only in few cases when there are risk factors for the general anesthesia, we do open surgeries, and a few complicated hernias or a few irreducible large hernias, we do the open surgeries.
If a hernia doesn't hurt, it's not a big deal.
No, if hernia is there, that is a big deal. We have to treat it, we have to correct it. Otherwise, it can become a big deal.
Sure. So that's about the Mythbusters.
Yes, ma'am.
Now I have a similar section which is rapid fire. Biggest risk factor for developing hernia.
As we have talked about, increased intra-abdominal pressure is the biggest risk factor of the hernia development. Like we have talked about, chronic coughing, straining at the time of stool or passing urine, or lifting heavy weights are the main risk factor for the hernia development.
What's the most common type of hernia?
The most common type of hernia is the inguinal hernia, which are more common in males. In females, the ventral hernia and that umbilical hernia is the most common hernia.
When should someone see a doctor if they suspect they have a hernia?
I think immediately when they suspect there is a bulge in the abdominal wall, they should consult the doctor, get evaluated for the hernia, and I think it's better to get treated by surgery
Immediately.
for the hernia.
Correct. What's the recovery time like after hernia surgery?
As we have talked, for open hernia surgery, usually in 1 or 2 weeks, patient starts doing his regular activities,
Mm-hmm.
and in 4 to 5 weeks, we ask the patient to do his regular exercise also. But in minimally invasive surgery, in few days, in 2 3 days, patient start doing his regular activities also. We discharge the patient early,
Mm-hmm.
and patient can start his regular physical activities or physical exercise in few weeks, 3 to 4 weeks also he can start.
So
So
if you had to debunk only one most common myth about hernia, what would that be?
most common myth about the hernia is the hernia, the less painful hernia, or no pain is there
Hernias.
in the hernia. We should not require the treatment is the biggest myth people are having, that I want to bust. That every hernia should be get treated, and it should be treated surgically.
Sure.
Nowadays, there are a lot of influencers who are telling that herbal medicines can
Okay.
treat the hernias.
Yeah,
A lot
yeah,
of
yeah.
they say the yogas can treat the hernias, but that is completely wrong.
Acha.
Hernia needs the treatment, which is a surgery.
Okay. So that's about the rapid fire.
Yes, ma'am.
And then I have the last question
Yes,
of
ma'am.
this, today's Sahyadri Health Talk.
Yeah.
That is, share a case which is very close to your heart,
Yes, ma'am.
and something which has left a mark on your heart.
Yes. Yeah, recently, we had one young patient, IT worker, who had a large hernia. I think
Acha.
it was a congenital type of, that means it maybe from his childhood, because pain was not there, so he
So
has
he
not
kept on pushing
consulted.
it,
But
huh?
it was a huge hernia. It was reaching up to the scrotum, which was irreducible,
Okay.
which was contents were mostly the omentum and bowel. But he was very worried about the surgery. He had a
Mm-hmm.
lot of fear about the surgeries, and he wants the hernia should be treated laparoscopically,
Mm-hmm.
because he wants to recover fast, and he wants to start his regular activities, his job activities as early as possible. But in irreducible hernia, doing the surgery with laparoscopy is a little difficult. We usually
Mm-hmm.
prefer open surgeries most of the times. But as considering his age and his concerns, we have given a chance to do a laparoscopic surgery. uh, it took more time than the regular surgery, but
Mm-hmm.
we are able to do a surgery laparoscopically. And the most good thing for the patient, that patient was so happy after surgery. Next day, he had a lot of fear about pain after surgery, how he will tolerate the pain. But next day when we went for the round, he was smiling, and he was happy that he didn't have any pain after the surgery. And same day he started walking around. In 2 days we discharged the patient. After uh, 1 or 2 weeks he came for follow-ups, and he was absolutely fine, and he started his job in a week only. So that is a very good feeling, that we have given a best treatment for the patient, and his main concerns we have dealt.
So we have always seen Dr. Phulchand Pujari as a very calm,
Yeah.
silent person, in spite of all the chaos that goes around in your department and all the
Yes,
emergency surgeries that you
yes,
do.
surgeries like
But
that
you
only.
are always this calm. So what do you do to keep yourself so calm?
Yeah, that is one thing, is that is my nature. I don't have to do anything for that. But thing is that we have to work, so better to work calmly.
Great, sir. We wish you all the best
Thank you very much.
for
Thank you. Nice
the
to be here.
beautiful journey that you have done so far, and
Yes,
many more patients who need your help in future.
thank you.
Wishing you all the best, and thank you once again, sir, for
Thank you
coming
very
on
much
today's
for calling
podcast.
here.
It was a wonderful interaction, and
Yes, from
honestly,
my
I
side.
wanted to talk more on this, but I think
This is a
we'll
big
have
topic.
to.
We can talk a lot, but
We can talk
there's
a lot, but we'll have to
a
stop
restriction
it
where,
here,
yes.
and we'll look forward to having you again on this
Sure,
podcast,
sure,
and we can
sure, sure.
discuss a few more
Definitely, I
topics.
will also enjoy
Till
that.
then, thank you so much, sir.
Thank you very much.